Hello and good night. Welcome to our new season of Pulse live on Choice TV. We're really happy to start this new season of Pulse. Last year was wonderful. We had very good guests. We had great interaction with our viewers. We had great callers. It gave us a really awesome opportunity to share with you the knowledge that we have in the hope that you may be able to make better use of the knowledge and make better choices regarding your health. So we're going to go right into it because we have with us a very packed program tonight. Tonight I have with me two very special guests. I will start by introducing Miss Soria Francis. She's a nutritionist. I can speak for Soria Francis because I have seen her produce really good results in my clinical practice where she's worked. Soria has achieved good results with getting patients to lose weight, with getting them to control their blood pressures, their blood sugars. I must say she has been quite an impressive nutritionist, so you should look out for what she has to say tonight. And I have another very important guest, very special guest. It would be Sami Keda. Sami Keda is a medical student, senior medical student at Atlantic University School of Medicine. Sami holds a bachelor's in public health, and he has 5 years of experience working in the emergency department as a technician. So Sami is very familiar with the runnings of an ER department, of what goes on in there. And Sami is himself right now making sure that he ends up being an ER physician and practices in the US. Sami is from Orange County, California.
That is correct.
So I like calling Sami Matt because, you know, he made it easy to remember his name. Sami told me, Dr. Matthew, if you have trouble, just call me Matt. So he calls me Dr. Matthew and I call him Matt.
And it worked.
And it works. It works. That way I remembered Sami and I remembered Matt and I remembered everything else about him. Viewers, tonight our program is titled The 15 Health Tips for 2015. So, outside of that, I'm sure there is so much more information. There's so much more that I'd encourage you to read and, keep in mind as you go through the year. But for now, I can assure you that the 15 health tips that I'm going to share with you are tips that I have actually proposed to apply to my own life. Things that I try to remind myself that are crucial and that would really benefit me if I was to make good with them. So our 15 health tips for 2015 will start, I think we'll get right into it. So you would see the image on the screen very shortly. Our 15 health tips starts with checking your status. So I like to say that tip number 1 starts with why. Viewers, I want you to remember that because it's supposed to spell an acronym of importance. It starts with why, and it's all about you and it's about your status. So, Sami, I think I'm going to start with you.
Sure.
Tell us, why is your status as an individual such a big deal? Why do we say, why as a medical practitioner, you think we'll make it a big deal that people know their status?
Right. First off, thank you for having me on the show.
It's a pleasure,
it's an honor.
Matt.
Yeah, it's really, really exciting here, actually, to be with you here tonight. So the reason I think it's very important is because you really have to know where you're starting from. Not everybody can start at the same pace. You have to. Some people have high blood pressure. Some people have, they have diabetes. They have different backgrounds. We all come, we're all different. We all have come from different backgrounds, different occupations. If you're hitting your 50s, you want to make sure you're up to date with your screening. You got breast cancer for the female, cervical cancer for those who are sexually active now. You got prostate cancer. All these things. You really have to know where you're starting. It could be very dangerous to take any step, any sort of regime without knowing where you're starting from. High blood pressure, diabetes, blood sugar, etc. So I think these are very essential before starting anything, really.
Right, and we like to say, actually I'm going to share this. This is something which was shared with me by a patient. You can actually learn a lot from your patients even as a doctor. Miss Helen Richards, who is a worker at Windjammer Landings Hotel. She has 2 tips that I'm going to mention. So the first one, she says that she shares with people is that everyone has something, right? And I think we need to really embrace that. Because if we appreciate that all of us have our strengths, but that all of us have our weaknesses, we don't feel bad about having a condition or the other. You know, we just know that, listen, this is what I have. And you know, as you're saying, it's important to know what is your strength and what is your weakness. The only way that you will get there is by having your status checked. So you're talking about doing it on the physical level, you know, and we say we start off with simple things like checking your weight, getting a BMI, finding out if you're overweight or even obese, you know, checking your blood pressure, we're saying, checking your
pulse,
blood sugar, your pulse, right? Your cholesterol levels, you know, checking your urine. Sometimes you do urine tests and you might be able to find in there that there's blood or that there's even sugar in your urine, and that helps you to.
These are so simple and basic.
It's simple and basic.
Simple and basic.
Simple and basic. And then we move from there and we say, you know, not only in the physical aspects of things, but take it on the level of the emotional. You know, how many people have had a tough time in 2014? How many people are still having a tough time coming into 2015 and maybe experiencing it, you know, periods when they lack motivation, they feel dull, you know, they're having trouble with insomnia, you know, signs that might be of someone who's suffering from depression.
Yes.
So, you know, you might need a depression screen, and that's what we say. You really need to check your status.
Yes.
Yeah. And then we move to other things. Great. So check your status is number one. I'm going to move to tip number 2. So viewers, I hope you're taking note. Tip number 1 started with Y. It's about you. It's your status, right? And tip number 2, right? So
oranges.
And we have Matt, and we remind our viewers that Matt is from Orange County, California.
That is correct.
Matt, do the oranges from Orange County look like these?
They look pretty close, Matt. They look pretty close.
They're very orange.
Yeah, they certainly do. Yes. And you know the thing with oranges is so many beneficial things in oranges. You know, the calcium, the iron, the copper, all that, and yet alone, a lot of people I don't really think are aware of the peel itself is actually so much more beneficial.
Right.
There's actually four times more the amount of fiber in the peel itself.
Right.
You know, than the orange.
Right. Right.
So I mean, a lot of people, they just kind of skip that peel. You know, they're kind of in a hurry, and
so
they're missing the good stuff.
Yeah. So Matt, you're a specialist on oranges as well, right? Because
Orange County.
Orange County. Yes. So I'm gonna bring in Soria to tell us, our nutritionist, to tell us more about these oranges.
Well, of course, one of the main things we know about oranges is that they're very high in vitamin C.
Right.
So, of course, you need vitamin C for not just antioxidant reasons in the body, but of course for your health.
Right.
It helps combat diseases. Like, you know, when you have a bacterial infection, vitamin C is very good for that.
Right.
So you want to have that in your diet, and that's one of the main reasons to get your oranges in.
Right.
It's also very high in potassium.
Right.
About 250 micrograms
of
potassium in there.
Wow.
So if someone, you know, if you're hypertensive, it would be a good thing to add to your diet.
Right. Potassium helps lower blood pressure, right?
Yes.
Definitely.
So what is the calorie content of orange about?
It varies. If you have like a medium orange, you're looking at about 80 calories.
About 80 calories.
It's very low.
So 60, 70,
and there's no
calories.
fat, and there's no sodium.
And there's no fat or sodium, right. And in terms of the vitamin C content, what percentage?
130%.
130%. So from one single orange, medium size, we can get all the vitamin C that we need for the day.
Pretty much.
Yeah, right. So oranges will cover us with vitamin
they're
C.
not too expensive too, right? I mean, they're pretty.
Oranges should be pretty affordable.
Yeah.
Pretty affordable.
You can get them everywhere, right?
Right. So Matt was making reference to the white of the orange.
Yes.
And saying that they're very beneficial. So when we say the white of the orange, viewers, we're referring to that inner part of the peel.
Right.
Right? So you know, there's the outer, very hard part of the peel and that inner fleshy, softer part.
Right. So when you peel off the skin, you're going to have that white flesh.
Right.
Most people peel that off. That is not a good idea because that's the fiber for the orange.
Right.
So you want to keep that on there. It's called pith, P-I-T-H.
Right.
And it is fiber. And it's very good because it helps your body break down the orange better.
Right.
So fiber, as you know, slows down the breakdown of sugar in the body,
breakdown
and
absorption.
so the pith is very important. So the orange will have sugar in it. Of course,
Right.
that's part. It's a fruit,
Right.
but the fiber is there to help slow down that breakdown. You want to keep it on there.
Yes,
So
definitely.
eat it with the orange. Don't take it off.
Very, very important. Okay, so we're moving on to tip number 3. I think before we do tip number 3, Soria, you wanted to share with our viewers this slide, which shows the interpretation of the food label.
Right. Now, I wanted to bring it up because the orange we said at like 80 calories.
Right.
So when you look for some, like you go to the supermarket, you're looking for something and you want to watch, what you're eating. You want to know how many calories, because you have to consume about 800 calories a pudding, right? That's like the average. So you can look at your label and you look for the where it says calories,
Right.
and it shows that the number of calories you're going to get per serving.
Right.
For that meal. So if it says you have, like in this one says 2/3 cups, right?
Right.
So that is 2/3 of a cup that, and in that 2/3 you'll have 230 calories.
Right. Right.
If you have the Crick's crackers,
Right.
the Crick's crackers will tell you 9 crackers per serving.
Right.
Wow.
Right. So 9 crackers
9
per
crackers.
serving.
Right. So one person has to consume 9 crackers, not more than that.
Right. Right.
From the other time, yes.
We're not very familiar with the whole concept of serving sizes.
That's
so
correct.
So one serving is per person, right?
That's right.
So
One
9
serving is per
crackers
person.
of 9 Cricks
9 Crick's crackers, yes.
is the
So-
serving for one person.
That's correct.
Right.
9.
Right. Right.
So when you find that most
Right.
people will eat a full packet
Right.
of Crick's crackers because it tastes good and you're hungry.
And they think the serving is 1 packet, I think.
They think that's good because it's.
I think most of us think 1 packet is a serving.
Even when you buy the really small packets of the spinach and the cheese, it's still 9 crackers.
Wow. Right. Right. So we need to go back to paying attention to the serving size.
That's correct.
Right, and what is in the serving size as well, because we may
That's
not
correct.
just want to have the whole serving, depending on different
So-
different percentages in the contents here. We might want to have less than a serving.
Right.
Because, for
Right.
example, I'm looking here, the sodium content is 160 milligrams of sodium on this label.
Right.
You may want to be careful of having a whole serving if
That's
you're
correct.
hypertensive.
Definitely, if you're diabetic as well.
Right.
Because, even if just because you're diabetic doesn't mean you don't have to watch the salt intake as well.
Right.
They are related. And
Right.
you want to prevent yourself from developing the other one if you have one.
Right.
Because, they are connected.
Definitely.
So you want to look for the sodium content, the cholesterol content, the fat content as well. And, of course, you want to know what vitamins and minerals you're going to be getting from that substance
Right.
that you're going to eat.
Right.
So
right.
it's very important to read up on your nutrition facts, find out what it is you should have. We don't have much time to go through all of them today,
Right.
but it's always a good thing
Take
to
a look
keep
at the
a
label.
note of.
Yeah.
Absolutely.
Take a look at the label. Yes.
Great. So I think we missed one little thing when it comes to the oranges. There's a word that we wanted to.
Antioxidants.
That's right. We want to
That's for sure.
remind our viewers of a word that's used a lot, but I don't think we embrace as much as we should. So antioxidants have a very important role, and we say most fruits, most vegetables are loaded in antioxidants. Sammy, tell us, what's the importance of antioxidants really?
Well, really, these antioxidants, they basically fight off these free radicals in our bodies. So, we have all sorts of cancers today, and I think really these, the term or the role of fighting off these free radicals are very important for us to understand. How to, what is this concept of free radicals? How do these antioxidants, overcome this? And I
Right.
think, it's very
So it's basically linking free radicals to cancer, right?
absolutely.
Yeah, and free
Absolutely.
radicals cause cancer. We know free radicals come about from everyday processes within the body.
Yes. In fact, you can even get them from daily vitamins.
From daily, yeah.
You got to be very careful and
Right,
cautious.
right.
Absolutely.
So we're fighting those free radicals by getting more antioxidants,
Yes.
which we see are in the fruits and vegetables.
Yes.
Right.
So, viewers, I have this story that I just have to share with you. It's one of my favorite stories. So I'm not sure if you're already seeing up here a slide of free radicals and cancer. There it is. Right. So I'm going to give you the story of free radicals and cancer, right? So it goes like this. 11 people left St. Lucia on a boat. There were 5 women, there were 5 men and 6 women. So let me correct that. 5 men and 6 women left St. Lucia on a boat. They were going to Bermuda, right? So on their way, right, the boat had difficulty, right? And the boat, they ended up needing to stop on a nearby island, on an islet nearby, right? So when they got off the boat, the 5 men, the 5 men got the 5 women as couples. So you now have 5 men with 5 women, and there's 1 woman who is left on the beach. So this lady is left on the beach all alone, right? The first night she looks at, the sun come up, the sun go down.
I'm not like
she's enjoying the environment. It's peaceful and stuff. By day 2, she starts to feel lonely, right? So she's no longer very happy about being on the beach all alone. By day 3, she starts to realize that Matt, your little brother Matt, that Matt is looking at her, right? So she realizes that Matt is looking at her, and she decides, you know what? She's not taking the loneliness anymore, the cold on the beach. She gets involved with Matt. But Matt was already with somebody else. Remember, there's 5 couples.
Mm-hmm.
So my lady on the beach, I call her the free radical, because she gets involved in where there was stability and causes
corruption,
instability, corruption. Now, the story doesn't end there. We're almost halfway through. So she gets Matt, and Matt's ex-girlfriend now ends up on the beach. And what do you think is happening with Matt's ex-girlfriend? Matt's ex-girlfriend is angry, right? So she becomes an even more dangerous free radical. She goes after somebody else's man, and the story continues and continues. So we say the free radical is that substance, that particle, that in its nature is unstable and causes instability around it, causes chaos. Right, so the story doesn't end there. Let me end the story for you. So comes along a fisherman on a fishing vessel. Now this is a fisherman who is tall, handsome, almost like you. Tall, handsome, with perfume, looking good, and he's on a fishing vessel, which is itself pretty impressive. So he comes and he sees this young lady on the beach, and he invites her, to join him. So he comes, she goes and she leaves the island, and she leaves the 5 couples behind, right? So the 5 couples are now happy because there are no more free radicals around. So the fisherman was the handsome fisherman with nice smelling fisherman with a big vessel, just the kind of fisherman anybody be, right? Right. So the fisherman has a very important role, and like we mentioned that the young lady lying on the beach all on her own is a free radical. The fisherman we call, very importantly, what do we call the fisherman?
Antioxidants.
The fisherman is the antioxidant. So I want my viewers to understand that when we talk about antioxidants, they're important because they get rid of all these particles which ultimately cause instability and actually push along cancers, cardiovascular disease,
weight loss,
aging, right?
Right.
Cholesterol
Great.
levels.
So viewers, I just had to share that with you. That's one of my favorite stories, man.
I must say, you made oranges look a lot more attractive. Absolutely.
Great. So tip number 3, we're going to have to move along. Tip number 3, and if our viewers can see here, says urology, a man's best friend. And, I think most men would look like a gentleman to the bottom here. Matt, why is urology so important?
It's very important. Like we were talking about earlier, Dr. Matthews, this whole antioxidant free radical deal and cancers, screening. Cancer is a really big deal, and I think later when we get closer, we'll be talking about the different prostate cancers in particular, and the amount of deaths that's associated with the prostate cancer alone is just so
Right.
high. It really shouldn't be that high, especially with something so simple. I mean, it's
Right,
after
right.
you know
But
you hit.
prostate cancer is slow growing.
Yes, definitely,
Right,
definitely
right,
slow
right.
growing. And the thing with screening these days, it's just so simple. I mean, it's you hit 50 and you do, it's like 50, it's like a minute a year. It's like
Right.
one test a year after you're 50, and it's simple and treatable and so.
Right,
I
right,
ju- yeah.
right. So I'm gonna, before we take a break, very quickly mention her. If we could take a look at that image again. I think most men are intimidated by the rectal examination, the digital rectal examination, where we use our finger to feel the prostate because they think it's going to be painful, and they probably imagine the whole finger all the way up the rectum.
Yes.
It's actually just the distal aspect of the finger that we use to feel the prostate, because the prostate is not very far in. So if you can see here, this is the area of the anus, and this is the prostate right there. So we get to feel the prostate by just inserting a very small part of the finger.
And the men need to understand this is not a sexual process. It's strictly medical.
Right.
The
And
doctor
it's
is
a-
simply checking.
It's a
to
medical
see what-
procedure, and it's very quick.
So
Yeah.
quick.
It's very quick.
Yeah.
We get through this in probably 20 seconds. I don't think it takes us more than 20
And
seconds
then
to
you're
do
good
this.
for the whole year.
That's right, and you've done it for a year. And I'll mention quickly that apart from just examining the prostate, the rectum, as we could see here, is another area where people develop cancers. So with the digital exam, we're able to feel for cancers of the prostate, and we're able to feel for cancers of the rectum. Now, guys may not be very much interested or intrigued by the discussion about the prostate, but I want us to see here the proximity of the prostate to the penis. And I want to mention to men as we go to our break that prostate problems can have an impact on the penis and erectile dysfunction. So you definitely want to keep that prostate in check, and that's why we say urology is a man's
Man's
best
best
friend,
friend.
right?
Check yourself before you wreck yourself.
That's right.
That's right.
Viewers, we're due for a commercial break. Stay with us. We've gone through 3 of our 15 tips for 2015. We'll be right back. Welcome back, viewers. So we've been talking about the 15 health tips for 2015, and I've had the pleasure of having with me Ms. Soria Francis, who is a nutritionist, and Mr. Sammy Keda, who is a medical student, senior medical student who has a bachelor's in public health and 5 years of experience as a technician in an emergency department in California. We had gotten to tip number 3, and I'm just going to make quick reference to something here which should be seen on your screens. I think people may not be aware of. So again, related to prostate cancer, I think it's important for people to understand that our number 1 cause of death in St. Lucia right now, well, from the most recent statistics that we have of 2012, would be malignant neoplasms or cancers. So St. Lucians are dying more from cancer than anything else right now. And we have, for every 100,000 people as recorded in 2012, we have 154 people. So in case you're not seeing this, this is 154 people for every 100,000 people. And we're saying our population is about 180,000, which means this is probably in the range of close to 300 St. Lucians dying from cancer yearly. Now, with that said, prostate cancer tops the list, and you may not see very clearly here, so I'll mention to you that 41 out of every 100,000 people would have died of prostate cancer. Men would have died of prostate cancer. So that means if we double that for our population size, or close to double, that means 70 to 80 men would have died in 2012 from prostate cancer alone. And that's our number 1 cause of death. So definitely reason for us to be careful, reason for us to think more about those antioxidants.
Screen.
Right?
Yeah.
Reason for us to screen and know our status.
Definitely.
Right? So tip number 4. And tip number 4 is pretty dear to my heart. It starts with A, so we're keeping check. Tip number 1
Absolutely.
started with Y, and we
Y.
said it was U for your status. Tip number 2 started with O,
for
and it's
orange.
orange, right? California oranges. Tip number 2, St. Lucian oranges are very good too, man. Tip number 3 started with U for urology. Tip number 4 starts with A. So tip number 4 is abstain. Ms. Francis, I'll start with you. We have in our image here a bunch of things that we need to abstain from.
Yes. Of course, you know, when most people think of abstain, they usually think of just sex.
That's right.
But we're looking at not just that aspect, but you're looking at in terms of the fast foods, the junk foods,
Right.
alcohol, drugs,
Right.
tobacco, marijuana,
Right.
you know,
Right.
anything that will that you'll get addicted to,
Right.
and you'll have a negative effect on your body.
Right.
So we're going to focus on this aspect because we know in our society we have a lot of people who they delve into those things a lot, and their health is becoming affected because of it.
That's right. That's right. That's right. That's right.
You know, it's so hard. I mean, it just seems like everywhere you go, you're surrounded by, you know, fast food or drugs or weed or alcohol or cigarettes. It just seems so hard to run away from these things. And I can
because they're all pleasures, eh?
Yes,
They're all pleasures.
Exactly.
They're all pleasures. In some way, they make you, at least for an instant, make you feel better.
better.
And we
Yes.
include within that list, we include the sexual aspect of it. These are all pleasures. And, you know, I remember Father, Archbishop Robert Rivas saying that we should be careful with the harmful pleasures. And I think that's what we need to see them as. They're harmful.
All right, beautifully
They're
said.
harmful.
Yeah.
They are.
Please, you know.
I mean, you know, sometimes people have fast food more than once, sometimes more than 3 times for the week.
Right.
You have the junk. We call it junk food, but you're looking at, you know, the pastries and the cakes and the sweets and the candy bars and
addicting,
all
yeah.
those things.
Right.
Yes, they taste really good, but you can't have one every day or, you know, as often as we have them.
Right.
You have the drinking of alcohol. We know the alcohol is a problem.
Right.
It's a huge problem.
Right. We've been ranked
Definitely
among
is.
the countries consuming the most alcohol.
Right.
Oh,
And it
wow.
starts at
Yeah.
a very young
Oh, yeah.
age. So this is not a thing. It does have a negative effect on the mind, as well as your heart and other parts of the body.
Liver,
So
yeah.
That's right.
alcohol, although it may make you feel good, it's a temporary thing and has long-term causes long-term damage to the body.
Right.
Yeah, and like Dr. Matthew said earlier, in terms of the neoplasms, that's so many cancers associated with alcohol.
That's
You know,
right.
You have liver
That's right.
cirrhosis, you have
That's right.
hepatitis, you have pancreatitis.
That's right. Cancers of the
So
gastrointestinal
many.
tract
It's
from
up
the
there.
mouth going all the
Absolutely.
way down
It's way up
are
there.
related to consumption of alcohol, and then smoking is related to a whole other
It's
bunch
number
of
one
of
cause
cancers.
of lung cancer, right
Number
there.
one cause of lung cancer
cancer.
by far.
Yes, absolutely.
Right. Right. So I think it's worthwhile to say that we need to control our pleasure-seeking behavior. I think we need to, you know,
Pull back on it a
pull
bit.
back on it, definitely.
Yeah.
Absolutely.
Definitely. Because it's costly and it's
Absolutely.
harmful. It's harmful and it's costly.
That is correct.
I would also like to say before we move on that we need to pay more emphasis or look more closely at what's happening with our children.
Absolutely.
Because this tendency to have this pleasure-seeking behavior is also
pass it
becoming
down to our
something that
children.
our
It's a
children are
dangerous
doing
path.
as well.
Right.
It's a really
Because remember,
dangerous-
children they will follow what you do, not what you
Right.
say. So even if you tell them, don't
Absolutely.
do this, and they see you doing it, they're going
Right.
to do that.
Right. That's what
Absolutely.
Now,
they
in
do.
terms of eating well, if they see you bring KFC for lunch every day, every so often, then they know that, hey, this is what I'm accustomed to eating, this is what I like.
That's right.
And it's also addicting. Imagine that happening to a child, that their
right.
brain is becoming addicted to having this fatty food, this sweet stuff. And even when you put their lunch bag together for school, you can't jam pack it with sweets, biscuits, and
That's right.
and
So true.
conkers and all those things, and then sweet juice on top of it. You're not giving them the necessary nutrition that they need. You jam pack their brain with a lot of junk food,
Right.
stuff
right,
that
right.
is damaging to their body.
And
By the time they hit their 20s,
They're
they're
already
suffering hypertension,
addicted.
diabetes, and they're addicted to this stuff.
Yes.
Right.
So we're not doing them any
And
favors.
it's
feeding them
impossible
this
to
food.
get them to change. In
Yeah.
fact, if we taught them to eat vegetables and fruits and eat healthy from small, they would have a hard time switching over to
the-
eating junk.
Totally
Right.
true.
Because
But if we do it the opposite way around, we're losing the battle.
That's
Very nicely
correct.
said.
Yeah. All right, so we move on to tip number 5, and probably this is one of my favorite because it's something I do. I believe in running for your life, you know. Not only when you're in danger, but probably to prevent danger health-wise, right? So, Matt, tell us, running.
Running. So yeah, I think the thing with running is it's so amazing because you have such a huge amount of you need that release of endorphins. You know, a lot of people, we have a long day ahead of us, or maybe we already had a long day and we're very stressed out.
Right.
Running, you're releasing so many endorphins. You're training your body for stronger infections and viruses and everything.
What do endorphins do? Just
they make you more happy, man.
That's right.
They make you more
they're
happy.
considered the feel-good hormones.
Absolutely.
That's true.
Yeah.
The good drugs.
Yeah. So
The
you've
good
had a
drugs, I call
hard
them.
day at work. It's best that you go jog.
You need a good high.
Yeah.
And that's the best way to
that's
go.
the best way to go.
Absolutely.
Natural.
Yes.
You know, very good. And we also would like to say that when you exercise, what you should try to do is not do a lot of exercise, or not do long duration, but do greater intensity. So yes, walking is good. I mean, any exercise, any form of exercise will help, especially compared to not exercising. But we would like to emphasize that if you do greater intensity, you push your body more, right? And you're actually causing your body to develop more. So you're causing your cardiovascular system to become more resistant, right? And later down, it will help prevent cardiovascular disease.
That's correct.
Right? You're helping your musculoskeletal system to become stronger, and will help prevent osteoporosis and arthritis and other conditions. So we're saying yes, exercise of any form is good. If you're not in health, in a state of health which would allow you to run, walk, but walk with greater pace every time, every day.
And
think of
challenge
walking
yourself.
faster. Challenge yourself. Yeah.
And you know what, Dr. Matthew, sorry, but that's just so beautifully said, because, you know, me personally, I'm in medical school, and I mean, I hear people, you know, you're supposed to go out and work out 2 hours. I don't have 2 hours a day.
That's right,
you know,
that's
I'm a
right,
medical
that's right,
student,
that's right,
and
that's
some
right.
people are working all day, they don't have 2 hours.
That's
don't
right.
have to.
That's
So the thing is to just don't limit yourself to time, but more so just excelling. And I really like the way you said that.
That's right. I think
So
it works.
user-friendly and easy.
Oh yeah, it works. So we'll see more solutions running, hopefully, in the near future. Okay, our next tip, as we have on the screen now, is eat less, live longer.
Very well said.
and there's a really below that, you know, this is really eating less, as on our screen. So Miss Soria Francis, our nutritionist on the panel, what do you think about eating less as allowing us to live longer?
Well, definitely. The studies that have come out have shown that people who eat less tend to have longer lifespans.
That's right.
Food is good for you, but food can also kill you.
That's right.
Right?
Excess.
So excess can kill you. And if you're overeating, then you're going to become obese, and then of course lead to all the other sicknesses, which will kill you. So if you were able to naturally live to about 80, 90, you cut your life down by, you know, all the way down to 40, 50.
Right, by having eaten too
By
much.
having eaten too much.
And we know the consequence of that
Precisely.
is obesity and everything else that comes with that.
Right. So eating less and simply basically just eating within the portions that
That's right.
are best for you. Best
That's
for your,
right.
you know,
That's
if
right.
you're training, there are different ways you eat, but once you're eating within a level where what you're putting in is less than the energy you're putting out,
Right.
then definitely you are expanding your life.
That's right. That's right.
And that
that's
is
right.
what we want our people to focus on. A lot of us eat too much.
Yeah, most
we
of
eat
us.
too much for the lifestyle we're living.
Right.
We're not running marathons. We're not busy building muscle.
Right.
We're not weightlifters.
We're not farmers anymore.
We're not farmers anymore.
Right.
So you find that we're eating the way our ancestors ate,
That's right.
but we're not living that type of life anymore.
That's right.
And we're more sedentary. Most of us vehicles, we're easy to go everywhere.
Right.
Most of us hardly walk. Sometimes
we-
just to walk up a flight of stairs.
Right.
We're breathless.
Right.
Yeah.
So our bodies cannot take that amount of food anymore.
Right. And we don't pay attention to the serving size at all. You know,
That is correct.
Almost makes you wonder what the serving size of a piece of macaroni and cheese would look like, right?
Oh man.
I'm sure Eddie said
I
we
think
should
Betty
eat
would be very
it's
happy with
much bigger than what the serving size of macaroni and cheese would be.
Okay, so eating less definitely has an impact on the body. If you're eating too much, like consuming way too many carbs, because down here, of course, most of our plates filled with carbs. So you have like
Right.
3 or 4 sets of carbs on one plate,
Right.
right? Very little greens. That is too much, especially you've had breakfast, you've had snacks, you've eaten that big plate of food, then you're gonna
Right.
have snacks later, and then dinner again. But you're not using up that energy,
That's right. That's right.
and that is definitely shortening your life.
Yeah.
Wow.
Yep.
So that's a focus.
And, but it's also a bit of a cultural thing because
It
you
is.
know we've developed a culture where you look better and people think you're in a better state of health if you're plump. You know. So
If
I,
you're
I
bigger.
remember I studied in Cuba, right? So I would come from Cuba and I'll be slim, all right, and my face would not be chubby, right? So when I get home, everybody's like, "What happened to you? You're so skinny. You look so small. You know what happened to you?" And it wasn't really that I wasn't eating well. It was just I was at medical school and I was very conscious of
What you're
eating
eating.
and exercising and stuff.
Right.
And so you come to St. Lucia, you come back home, and everybody is freaking out. What happened to you? You got so small. Then you
And
eat,
everyone
so
wants to
everybody
feed
feeds
you.
you. So you get stuffed when you come home, right? To no fault of anybody, because they're not thinking that life is good for you. So
Exactly.
So you go back to Cuba. I tell you, you go back to Cuba, and listen, the Cubans ask you, what happened to you? You put on so much weight. What happened?
Yes.
So because they're all a lot slimmer than we are.
Right.
Every time I put on weight in St. Lucia, when I go back, I lost it very quickly because you just don't fit in. Everybody's asking you, what happened? You're so fat. So I think we need to change a bit our perception of what what a healthy person looks
Looks
like.
like,
Yes.
absolutely.
Yeah. Great. So we move to tip number 7.
Bananas.
This is another one for you, Soria.
Bananas.
It starts with B and it's for banana.
Bananas.
And it's not banana in a good sense this time around. We're actually going to put a little pressure on our use of banana here.
Yeah, because it is our main fruit here. We love bananas. They taste really good, but they're extremely high in calories.
That's right. They're really high in calories.
Right. So you're looking at an average person will consume, if they eat bananas, maybe 2 bananas
Right.
on average, right?
Right.
And you're looking at the calorie content of the bananas, right? A medium one would be
But 200 calories.
200
calories.
200 calories.
that's in one banana.
Right.
That's a medium-sized banana. That's an
Wow.
average-sized banana.
Right.
Now we have these really huge bananas
Oh,
that you
yeah.
get in the supermarket now.
Yeah.
All right, so double that.
Double that.
wow.
So and we have people who eat 4 and 5 bananas.
That's right, because
So we're
it tastes
saying
good.
Yeah, so we're saying 200 calories by 4 or 5 is 1,000 calories.
And that's just from banana.
Most
from the
people should
bananas
not have
alone.
You
in
gotta-
a day more than 2,000 calories. I mean, you actually
Precisely.
need to be doing stuff to need 2,000 calories. So you can overeat by just having had 5 bananas for the day. And we spoke about
the sugar levels.
the sugar levels.
The sugar levels.
28 grams to 30 grams of sugar in a single banana.
Right, which we are saying 28 or 30 grams of sugar is equivalent to a number of teaspoons, right?
Oh my gosh.
Yes.
It's equivalent to about
Four-
seven,
But-
Oh,
seven, six, 7
6 or
teaspoons
7
of
teaspoons
sugar.
of sugar.
So in one
That is
banana, that is a
high.
lot of sugar.
That is
In
high.
one day, that's a lot of sugar, man.
Now, it's too much for the body because you don't want to just eat 5 bananas for the day. You want to
Right.
have your other meals.
That's
Exactly.
right.
So if you're going to have a banana, of course, it's better to look for the smaller sizes.
That's right.
And of course, not fully ripe,
Right.
because the riper the banana, the more sugar it has. So you have people who are diabetic who want to eat bananas. They like it,
Right.
and maybe due to where they live, it's easier for them.
Right.
So their focus should be maybe like a half-ripe banana, a small size, rather
Right.
than the larger one that's full ripe.
Right.
So
right.
that's a way you can get that in there. But of course, beware, bananas, they taste good, but you,
And they're-
and
and
you
they're
have to be careful
they're
with them.
nutritious.
They're nutritious.
They're
You get good
nutritious.
stuff from them,
Definitely.
but of course, too
Moderation.
much is
But we
not
need
good
to
for
be
you.
careful.
Moderation.
No.
Everything in moderation.
And everything in moderation.
I mean, with what we've said, we understand why cyclists use, when they have these very long distances to cycle, that they have a banana because they need that sugar. They need that.
It gives that
that
sustenance.
amount of sugar.
Right.
Right.
Because they can get to burn. So that's to show if a cyclist is going to use it, how much it actually is, how much calories it's actually packing.
Definitely.
Yeah.
Definitely. Tip number 8. And we say tip number 8 is another food that we want to be careful with. So tip number 8 is related to eggs. And again, we say eggs are not for everyone.
Yeah, they are a food that has been debated for the
Right.
longest time. Is it good? Is it not good?
Right.
Eggs are very good for the body. They
Right.
are one of the what they call a superfood because it has a lot of protein. It has a lot of vitamins, minerals in there, vitamin D, which is we need.
Right.
It also has fat and of course cholesterol,
Right.
which is what the debate is all about.
That's right.
So when we talk about it's not for everyone, if you are someone who is predisposed to having high cholesterol, if you know anyone in your family who's had a high cholesterol, or if you have been diagnosed with it,
Right.
then this is a food that you have to look out for. You have to be careful with it.
Definitely.
You do not want it to exacerbate the problem, make it worse.
Right.
So of course, if you have that issue, then you may have to modify how you use it. Maybe you can just use the protein, the white part, and exclude the yolk part.
Right.
Okay.
But if you're normally and you're healthy, then don't that people still overconsume the egg. So
Right.
you may put together 4, 5, 6 eggs
Right.
and scramble that or fry it and have like that for breakfast.
Right.
That's way too much for one person,
Definitely.
right? Looking at 1 or 2 eggs maximum per person per day.
Per day.
Definitely. Definitely.
Okay.
And we're saying
Right.
look out for where egg is an ingredient, whole
Yes.
eggs. So
Right. So
some
things
people
like
do
mayonnaise and
definitely.
things like that that we
Some,
use
you know,
a lot of.
eggnog, and probably mac and cheese might have
Yes.
egg in there.
It
Cake
depends.
would have egg
Yes.
in there.
Right.
So egg is not for everyone, especially those people who would have had problems with cardiovascular disease, would
Right,
have
heart
had heart attacks and
disease.
stroke. You just don't want to be taking in any extra cholesterol.
Right.
And again, just so that we're familiar with what's our local situation, we mentioned earlier on that cancers are the #1 cause of death. All right, so I'm showing her another image where we see that the second leading cause of death, at least from 2012, will be cerebrovascular disease or strokes, followed closely by heart disease. And in a lot of cases, I'm sure, would be heart attacks. So we want to be very, very careful with our blood pressure, our blood sugar, our cholesterol, these things which can actually lead to strokes and heart attack. All right, so we move to tip number 9. And tip number 9 is another debatable one on the medical side. But I have come to the conclusion that it should be placed in there. I have come to the conclusion that an aspirin a day might actually keep the doctor away. In medical circles, we at one point embraced aspirin because it's very good at preventing heart attacks and strokes. At least certain types of strokes, it might be very good with all these cardiovascular disease and with helping issues with poor circulation. You know, a lot of people get amputated because of poor circulation in the lower limbs. Arterial flow becomes decreased and the tissues don't get nutrients, and we're forced to amputate because the tissues die off slowly, wounds don't heal. So aspirin has always been known to be good for that aspect of medical care. With that said, we'd always been cautious about aspirin for 2 reasons: that aspirin can thin the blood, and that aspirin has a tendency to cause gastritis and to cause peptic ulcers. But we've actually started to embrace aspirin a lot more now for one main reason: that aspirin is being seen as being very good in certain cases of preventing cancer, especially colon cancer.
Wow.
Right? And we're saying that in a population like ours, where cancer is the #1 cause of death, we may want to consider embracing aspirin a day, a daily small dose, what we call a baby aspirin of 81 milligrams. Aspirin a day might help to keep the doctor away. That's tip number 9. And we speed along to tip number 10 before we take our next break. And tip number 10 is use only as prescribed. Matt, Sammy, I'll come back to you.
Yeah, I think this is really important because a lot of the times we have children at home, and sometimes we read on the box it says for fever, and we have a little child that maybe has a fever, and we automatically run to the aspirin, and that's very, very dangerous.
Right.
That you should never give a child who has a fever aspirin.
Right.
So be very cautious.
It causes Ray's
syndrome. Yes.
Right, which is an encephalitis, swelling of the brain.
Very dangerous.
Very dangerous. So aspirin is not for children. And in general, we say use only as prescribed as well, because there are lots of people who use medications as they wish. So, you know, there's this term that we don't like very much, but we have to end up using so much, which is non-compliance.
Compliance.
Yeah.
Right, so you want them to remember that if the doctor has given you a prescription and he's asked you to take it for a certain number of days, take it for all the days he's told
As prescribed,
you.
right.
So that's what I mean by as prescribed, because even if you're hypertensive,
Right.
and they give you the medication, you take it today, you feel great.
Right.
Do not stop taking it. Continue until that length of time has passed,
Right.
until the amount is done. Otherwise, it will not work, because of course the B-side,
Right.
when it's given, it's in
Right.
a very low dose.
Right.
It has to be taken over over a period
Over a
of time.
period
Is that
time.
correct?
That's right. That's
so
right.
once it's taken over that period of time, then it's going to do its job. But if you take it today, don't take it tomorrow. Take it when, whatever time you feel like the day after. You leave it for the rest of the week. You don't
Right.
take it. It's not going to work.
Not going to work. Matt, I want to come back to you.
Yeah, sure.
Because in the U.S., somehow I think Americans have embraced the pills, you know, embraced medical care with all these pills much more. Although in the U.S. there are always ads which tell us all about the side effects that, you know, that's giving the pharmaceutical industry a beating. Americans embrace their medications and they use them. You know, why is that the norm over there? Because we have a hard time convincing solutions to.
I really
to
think
use these meds.
education, Dr. Matthews, education, knowledge is key. I think we have a much more, the lifestyle there is very, very focused on informing people.
Right.
You know, whether it's through the educational system, business, you know, business, anything you can think of, it's always information is key. You know,
Right.
the number one thing is to prevent. It's prevention,
It's
really.
prevention.
And how do you prevent? By
By
informing
informing
people.
people.
You
That's
get in
right.
there. You got to get in there. You got to get your hands dirty. You got to, you know, advertise, websites, social media.
Right,
That's
right,
that's
right,
that's
right,
one thing
right,
I
right.
really think we can use here at St. Lucia is informing people. Just going out there, getting on the street, having events. Anything really. Websites, social media, Facebook,
Right.
Twitter, anything. Just
Right,
get the
right,
word
right,
out there.
Right. Yeah, I think that's the best way to build confidence, right?
Absolutely.
Because I think our patients doubt us a lot when we say you need to use this for life, and they wonder, you know, it's a life sentence, and why is this gonna, why do they need this, and all the side effects. They start to doubt us, I think, a lot more when they don't feel like they understand what's really going on. So
What's going on.
I appreciate that point.
Absolutely.
Yeah, we'll try to definitely do more to keep our people well informed. Thank you very much, Matt.
Absolutely.
I think on that note, viewers, we're going to take our second break. We'll be right back and we'll start to take your calls. Stay with us. Welcome back. So we're into our final segment and we're going to wrap up as we go along. We will take your calls. We'll take a few calls before we do. So if you want to, you could call us, right, at 452-7347. We'll go through our last few tips here. So our tip 11 is tea time. And take time to drink some tea. Right.
But of
Miss
course, tea
Francis.
is very good for the body. Well, not all teas, but you know, green teas and some of the black teas are good for the body, high in antioxidants.
Again, high in antioxidants.
But they're very good for the body, good in preventing dementia, right? Alzheimer's. Yeah.
Alzheimer's, yep.
So it's good to get the tea in, and you know, it's better than having, of course, the soft drinks and those other things which
Right.
damage the body. So tea does have its benefits. Make time for tea.
That's right. Make time for tea. And green tea is spoken of a lot, eh?
Absolutely.
Yes.
Right?
it is.
And you know, our cocoa tea is said to have 3 times as much antioxidants as
Antioxidants.
green tea. So,
Yes.
Oh, wow.
Yeah,
The
so
cocoa tea is good. Yeah,
Right.
cocoa tea is good.
Right. Okay, we have our first call. I think I'll take this call. Good evening, caller. You're on the air.
Yes, my name is Miss Francis.
Uh-huh. Good
I have
evening, Miss
high cholesterol,
Right.
right? And I'm taking a tablet. Let me look at this here. I am. Oh gosh, just now 1 second. Okay, I'm taking a tablet the doctor gave me.
Right.
And plus I'm taking a lot of cayenne pepper
Right.
and turmeric.
Right.
And the doctor told me to take baby aspirin. So I want to know
Ooh.
if it is dangerous for me to take the baby aspirin and the turmeric.
Right. Miss Francis, you want to comment?
Yeah,
firstly?
the turmeric is a blood thinner, and also the aspirin. So that is something you have to be very careful with.
Definitely.
Uh-huh.
Definitely, Call. I wouldn't do that. Turmeric is a very good, it's a very good food, I think.
Yeah, it's very good, but if you're taking it, don't. Well, if the doctor prescribed the aspirin, then you'll have to stay off the turmeric.
Right. it's
But I
not-
don't take the aspirin every time.
Right. Right.
Okay, so if you're taking the aspirin, if you are using the aspirin, the time you are using the aspirin, don't use the turmeric. Give yourself a day or two after you've used the aspirin for it to get out of the body, then you can use the turmeric, okay?
Okay then.
Right. And remember, aspirin actually stays in your system for up to 3 days, So,
Okay.
so be careful.
Yeah,
Turmeric, I was saying, is a very good herb.
it is.
Very strong anti-inflammatory.
Yes, very good.
Been
But-
used for many things.
Yes, but you have to look at the blood thinning aspect. So yes,
Definitely,
she has to be careful
definitely.
with that.
So, good evening, caller. You're on the air.
Yeah, good night.
Good night.
I listened to you guys on very interesting topic.
Thank you very much,
Thank
caller.
you.
Yeah, my problem is I'm suffering from pressure.
Uh-huh.
I do exercise a lot,
Right.
and you find when I miss the how they call it, the ANLODITIN.
Mm.
Yeah, when I miss it a few days, I feel dizzy.
Mm-hmm.
But with that also, I use the paroxetine.
Mm-hmm. Mm-hmm.
Okay, so
Okay.
I mean I do exercise a lot,
Right.
as I said, and I heard people saying that to every time you exercise, it will get your pressure better.
Right.
But I cannot do without the medications, as I said.
Right.
I've
Right.
tried it many times, but I have to go back to it.
Right. 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 So, Paula, what I want to share with you, in summary.
I'll listen to you on the end.
No problem. So I think,
Thank you.
thanks for calling. I think what we just need to share with the caller is that not all hypertensives can be treated, through a change in their lifestyle. Yes,
Yeah.
high blood pressure is in many cases caused by lifestyles which are not the best, and you change it initially to see if the change in lifestyle would get the pressure back to normal. But not everyone will find themselves in that category, So
Yes.
so you must use your medication if it comes to that, and you remember that your medications are there to protect you. Right, we're going to take another call before we switch to our next tip. Good evening, caller. You're on the air.
Hi, good night.
Good
Good
night, caller.
night.
And how are you all doing?
We're doing
Doing
good.
good,
Thank
thanks.
you.
It's a very interesting program.
Thank you very much.
Well, I have acid stomach,
Uh-huh.
and I take in the Nexium.
Nexium, right.
Yeah, and then I still feeling it. What do you
Right.
think I must do again?
Right. Okay, so again, quickly, caller. So what I would suggest you do, Nexium is a very good medication that really should treat your gastritis issue or your acid reflux issue very well. If you're still having difficulty despite using the Nexium, then you need to get tested for a bug called H. pylori. So H. pylori is a bug that itself is actually the cause of gastritis and peptic ulcer disease, right? Unless you treat the H. pylori with antibiotics, you will continue getting issues with your stomach, right? So if you're using Nexium, which itself is a very good medication, but still having issues, please, you need to see your doctor, get a test for H. pylori and see if that's not the problem. If it's not H. pylori, then you might want to have further tests done, like get an endoscopy, so that they put a scope down there and see what's going on in your esophagus and your stomach.
Because I haven't got no diabetes, no pressure. I never used to have them stuff.
Right.
And then I'm a farmer.
Right,
It's farming I just do.
right,
And then anything you see, I eat. I doesn't eat no citrus because of my acid
Because
stomach.
of your acid
Yes.
stomach. Yeah, there's
Right.
something is
Yes,
wrong.
something is
Is wrong. I think you should get seen again, and at least remember those aspects that I mentioned, that there might be a bug causing the problem, a bacteria that needs to get treated with antibiotics, or there might be other tests
So,
necessary.
like, one more question before
Sure.
and I'll listen. So, what you mean to say? I can go to Dr. Lashley and take a extra whatsoever?
Oh yeah, so Dr. Lashley, if I remember correctly, is a radiologist. I don't think Dr. Lashley would be the first person you should go to. I would
Which doctor you can
suggest
advise me?
I would suggest
please?
you go to a general practitioner who or of your family doctor who would most likely uh, you know
Run some
tell you more
tests.
about the test for the bug and tell you more about other tests to be done. I
So,
would start
Dr.
there.
Fentrose is all right?
Doctor, sorry?
Fentrose.
Dr. Centrose, there are many Dr. Centrose. Are you talking about Alfonso Centrose?
No, like the old one, not the young one, the
That should
old
be
one.
PAW Centrose.
Yeah.
Well, Dr. Centrose is a very nice gentleman, I think, and very competent. I think, although he's a gynecologist, he should be able to guide you as well.
Okay, thank you very much.
You're welcome, caller. Thanks for
Okay,
calling.
bye.
Okay,
Mm.
Bye-bye.
you're welcome. So we're gonna push along to tip number 12. Okay, let's just take this next call. Good evening, caller. You're on the air.
Good evening.
Good evening.
I must say you'll have a great program.
Thank you very
Thank you.
much.
Yes, but I wanted to know, what do you use for lost weight?
For weight loss,
Yeah.
right?
Well,
thank
generally,
you for the call.
thank you for calling. Generally, for weight loss, first we want to find out exactly why you're gaining weight. There are many reasons why a person may gain weight. It could be stress, it could be hormone issues, not just eating habits.
Right.
But if it is, and that's the case, then you would like to find out what are your the quantities you're eating now, the foods that you're eating,
Right.
and we'll modify that.
Right.
And adjust it to suit your lifestyle, because no two people are the same.
Right, and we might go back to tip number 6, I think it was. Eat less, live
Eat
more.
less, live
Yeah.
So
more. Right.
losing weight is a lot of time about
So-
eating less.
Yeah, because what you can start doing, just start reducing your quantities. If you eat 2 bread, let's bring it down to 1. If it's
Bread,
1, down
yep.
to half, that kind of thing, to start there.
Right. Okay, so we lost that call. So we're gonna take tip number 12 very quickly. Iron supplements not for everyone. So before I
Right.
take the calls, holding on, we just want you to know that iron is sometimes linked to dementia, right? To Alzheimer's disease. So iron and other heavy metals like aluminium, like
Zinc.
copper, you might want to be careful with taking supplements of iron. We say leave iron for the people who are anemic,
Right.
right? So iron is not for everyone.
Better
Callers-
used if prescribed.
Yes, use as prescribed. And if you're taking a supplement, a multivitamin supplement, take one which does not have iron. Let me take another call. Okay, we lost our call, so we're gonna move along. Soluble and insoluble fiber is tip number 13. So
Right. And
tip number 13 is F for fiber. We've lost
F for
track. Eh?
fiber.
We've lost track. All right, let's take this call. Good evening, caller. You're on the air.
Yeah,
Good evening.
yeah. I'm calling back again,
Right.
and there is this problem with my granddaughter.
Right.
As a matter of fact, my son just brought her to the polyclinic.
Okay.
She has been vomiting and diarrhea for the last week.
Right.
Call it that. What would you recommend that we give her to avoid vomiting and using her bowels? And she's very, very, very active.
Right. Right.
I'm listening to you over there.
Right.
Dr.
Caller.
Mafia.
Sure. So caller, I'd like to say, because I'm very familiar with the staff at the Gose Polyclinic, that there are some wonderful physicians over there. I can think of a few. I think they're in a great place to examine and take a proper history, examine and treat your granddaughter, successfully. It sounds like a gastroenteritis from what you said, but I think I'd let them I'll let them handle it. I'm sure they're more than capable over there.
And maybe just make sure that she's hydrated too. If she's has
Yes.
diarrhea, make sure
Right.
there's fluid.
Yeah. Good evening, caller. You're on the air.
Hello, good night.
Good night.
Good night.
I want to know what's the healthiest way to gain weight?
To gain
Good
weight.
question.
That's a
Good
very
question.
good
You call us
question.
off, you definitely call us off guard with this one. All right.
Okay, so most people have the issue of losing weight, but she wants to gain
Gain
weight.
weight,
So,
yeah.
yes, that can be an issue. The healthiest way to gain weight is, of course, we have to take stock of what you're eating now and find out how your body responds to an increase in a more protein-based diet,
Right.
as opposed to a carb-based diet. In terms of, because
Definitely.
even though you want to gain weight, you want to gain it healthy.
Definitely.
So you may, of course, need to increase your quantities of what you're eating,
Right.
and of course, may have a more higher protein-based diet
Definitely.
than anything else.
I would agree on 100%. Good evening, caller. You're on the air.
Hi, good evening. I
Good
listen to
evening.
your Hello, can you hear me?
caller. Yes, we can hear you.
I listen to your program very often, and
Thanks.
one of the things that I've found like a recurring theme is a lot of people will call. They've been to a doctor,
Right.
and they will still ask you what can they do or whatnot. Can you tell us how important it is to one? Because I have that problem with my mom.
Right.
A lot of the older people too. They just go to the doctor that they're familiar with, and that's the doctor they see for everything, regardless of whether that doctor is an internist or a
Right.
gynecologist or a general practitioner.
Right.
How important is it to go to the right doctor? And how important is it to follow through with the medication and just that doctor? So, for instance, if I'm seeing a doctor I've seen that doctor once and they've given me a medication, it's not working. How important is it to follow through with that doctor?
Without
I say,
seeing
okay,
them, yeah.
this medication
Very
is not
question.
working with me,
Good
and
question.
what's the next step? And
Oh, yeah.
but most importantly, how important is it to go to the right doctor? For instance, going to a general practitioner and not a gynecologist for everything.
Right. Matt, you want to
Yeah.
answer that
I'll
question?
listen
Thank you
to
very
you.
much for calling.
That's a great question.
I think that's an awesome question.
Yeah,
and
I think so too.
I think, well, obviously I'm not a doctor yet, but I think basically from what I know is every doctor has a general idea of what's going on. He can kind of not maybe pinpoint the exact thing of what you may have, or might not be able to pinpoint the diagnosis, but if not, he may be able usually to guide you in that direction. So I think if you have some kind of a skin infection, and you're at your gynecologist, I think maybe based on everyone is trained at a level where they will know or be able to identify some sort of
Of condition, right?
yes
Yeah.
where they'd be able to okay you need to go see a dermatologist.
Right,
This is
right,
out of my scope.
Right. I think too, probably everyone should try to find themselves a doctor who is, who's the person who knows them best. But if you're going to do that, I would suggest you try to find a general practitioner or a specialist in family medicine to be your personal physician. Your
Trust.
personal physician is that person who knows you best.
Yes.
The general practitioners deal with everything and stay current to a certain level about almost all areas. Specialists tend to dive into their field, so you don't really want to have a gynecologist, let's say, as your personal physician who deals with everything. You want, I think I would recommend having a general practitioner be your central person. But it really depends, because as you've said, Matt, a gynecologist would have sufficient knowledge of the general practice as well to properly guide
Exactly.
that person. So it probably isn't even necessary that it be a general practitioner. Just make somebody your central physician, that person who guides you, that person who knows you very well, because you've been going to them for a while, knows you very well, and then can guide you really well.
Dr. Matthew, so I just want to say, you also I think you have to. It's very important that you have that, you establish that level of trust with that physician as well. I think
definitely.
keep looking until you're confident and you can trust and
Definitely.
you're happy with that.
Definitely. Okay, so
something I like to state also about that same issue. Yes, you get a general practitioner, but of course, if you do need help in another direction, then that general practitioner should be able to direct you in that path.
That is
So,
super important.
and that's why you have specialists.
That's
they
right.
have specialists
That's
for those
right.
areas. So, of course, you have Dr. Matthew is awesome. Trust me, great.
Thank you very much.
And if you need to, if you need another doctor for something else, he'll definitely tell you, hey, you know,
Yeah,
you
we
should
need
go
to
to this
refer.
doctor. We need to refer you
We
to
need to
this
refer.
person.
Oh,
So
yeah.
that's what you should look for in your doctor.
Definitely. Okay, we'll take another call. Good evening, caller.
Hello.
Hello.
What do you have for, what would you prescribe for gas? I have a terrible gas. It makes me vomit.
Oh, that one is a bit difficult. I think, caller, I think you'd benefit from being seen by a physician. You know, you might assess it as gas. You know, you might be seen by a physician and be told that it's something else, and then everything is different from there. You know, I think. Sorry.
Which physician do you think I should go to?
I think a general practitioner as a start is a good physician to go to. If he can't handle it, he should refer you to somebody else. But a general practitioner should be where you start.
Okay.
Okay.
All right. Thank you.
Thank you for calling. Okay, so tip number 13. Let's see. Soluble and insoluble fiber. Fiber is huge. F for fiber is tip number 13. I wonder if our viewers were keeping track of our tips and the letters that they start with, because it ends in a very special way. So, Ms. Francis.
So yes, fiber. You know, we talk about it a lot, but most people don't understand exactly what fiber is all about.
Right.
So fiber is what the foundation of your diet should be, because it is basically what keeps your weight in check, helps your body deal with hypertension, diabetes, and basically keeps you healthy. So fiber is broken down into two parts. You have soluble fiber and insoluble fiber. Soluble fiber, it helps what you eat dissolve. It dissolves in water and helps basically slow down your digestion.
Right.
So that your body takes time to basically
Process
break down
that food,
process the food,
Right.
And especially sugar. That is
Especially
important,
sugar,
especially
definitely.
sugar.
So you don't get those spikes.
You don't get the spikes in your blood sugar.
Right.
It slows it down, prevents the sugar from rushing into your bloodstream. That way your body uses it slower and you don't get those spikes, which is a big problem for diabetics.
Right.
The insoluble one is the one that helps you eat your bowels better, helps add bulk, helps you feel full.
Right.
So that is why it is so important, because it has two very important roles. It helps keep your bowels fluid, but it also helps your body deal with how it deals with the food.
With the food.
Yes.
Okay, let's take this call. Good evening, good night, caller. You're on the air.
Good night, how are you? What's up?
Doing good, thank you.
Yes.
Yes, you can go ahead. Go ahead, we're listening.
Good evening, Miss Francis, and good evening, Dr. Matthew and the gentleman.
Good evening, sir.
A very wonderful program. I must say that it's very informative, very educational. I have been listening and I am quite impressed
Thank you very much,
Thank
sir.
you.
everything that has been going on. I wish we had more of these programs on our television. That would benefit our nation.
Thank you. We'll
But
try
I want to
keep
go
it
back
going.
to your second tip, and that is the orange.
Definitely, okay.
And I find that you had it very high.
Right,
It came out at number 2.
right.
And so for this cause, I think it's probably a very, it's a wonder fruit, so to speak. But I want to know whether when you speak of oranges that you are putting it in the category of all citrus.
Oh, very,
That's
very
my
well
first
said.
question.
Very, very well said. Yep.
And the second thing is that there are different types of oranges as well. So these are my two questions, and I just wanted to say
Very, very well said.
well done and very good program.
Thank you,
And have a
sir.
good
Thank
night.
you, sir. So let me say quickly why it is number 2. Thank you for calling.
All right, I'll listen on the television.
Definitely.
Thank
Thank
you.
you for calling.
Yes.
So I'm going to explain quickly why we have it as tip number 2. Because it's O for orange,
Orange.
which falls within our acronym.
Yes,
But
which you see at the
definitely-
end.
Yes, which we'll see at the end what it forms. But orange, is also very good and belongs up there because of its antioxidant content.
Very
And
high.
anti-inflammatory.
And it's very
as well.
very good if it's antioxidant content, anti-inflammatory content. fiber content.
Fiber
So
content.
you would notice, viewers, that some of the things that we spoke about later on, orange actually contains,
Yes,
right?
absolutely.
And you know, there's even the suggestion that orange, the color orange, is great because of the fact that orange, the color orange, helps with depression. Helps
Absolutely.
create new ideas.
Yeah, it's
You know,
colorful.
people are having a tough time.
colorful.
You know, with the economy and
Now-
stuff. It boosts your mood.
What I would like our people to know is I know that our oranges aren't usually the orange color. It's yellow and sometimes a bit greenish.
Right.
They're still good.
Oh yeah.
It doesn't change it. They're still healthy.
So it's still an orange.
It's still an orange.
Definitely.
The properties make it an orange. So
Right.
it's still awesome to eat. Don't discard it just because it's not the bright orange color. It's still good
It's
for
still
you.
it's still good, and
Use it.
he's right, I think, as well in saying that the citrus family tend to be high in antioxidants
and vitamin
and
C.
anti-inflammatory.
That's correct.
So I think we're going to have to take what might be our last few calls. This one dropped. Good evening, caller.
Good evening.
Good evening.
One question.
Yes.
Can you explain to me what causes high blood pressure?
Oh,
Good question.
Very good question.
Very
Yeah.
good question.
Very good
Thank you,
question.
caller.
I'll listen to you over there.
Thank
Okay.
you.
Okay.
So Matt, you know, I'm
Yeah.
sure you're in a position to get into what causes high blood pressure. There's a classification, but I'll let
Yes.
you.
So I think there's a lot of things really that can cause high blood pressure. I think really the number one thing we should really worry about is bread. Really, I think we eat bread with everything. Dr. Matthews, like there's a lot of
White
bread.
bread.
Yeah, I mean we go to Subway for example. A foot long, just a Subway. The bread by itself has about 1,200 grams of salt.
Of salt.
That's what you're supposed to have per day.
Yeah, that's
So I mean, we're not going to live off that alone. You know, we're definitely going to have something else, you know, on the side or something else for dinner that's also going to either contain bread or some other sort of salt.
right.
So I think we just really have to
Be
limit
very-
the
It's-
bread.
Matt, it's interesting that you zoned in on the bread, man. I didn't expect
I
that.
am the salt of bread, man.
Right, but you're
Yeah.
you're right in saying bread and definitely bringing out its salt content because we've been saying for a while now that salt is a major factor for salt intake is a major factor for becoming hypertensive.
Right.
But I think, as we come to a close here and we pull things together, related to high blood pressure, caller, I think we want you to know that high blood pressure is in part a lifestyle disease, right? And, there's a classification of the causes for high blood pressure, which is very medical, but the cause of high blood pressure, we say, are 70 to 80% unknown. So
Yeah.
in most cases, we can't really put our hand on what caused it per se. We know that salt is a factor. And then there are other causes. So there are causes which are related to the kidneys. There are causes which are related to the endocrine
Obesity.
system. Obesity. There are other
Diabetes
emotional
sometimes.
disorders, psychological disorders. There are other causes which might
hereditary.
some of it might be hereditary. So there are many causes. I think this is going to be our last call. Good evening, caller. You're on the air. You're our last call for tonight.
Good evening.
Good evening.
I would appreciate if you give me advice on my cholesterol, bad cholesterol.
Bad cholesterol.
Yes, I am on tablets, but I'm not so keen on taking tablets because I'm already taking tablets for my blood pressure.
Right,
I've had blood pressure for more than 30 years,
right.
and I'm not happy about taking more tablets. So I wonder if you could suggest something else,
Right.
that I could take for my bad cholesterol because it's not improving; it's just getting worse.
Right. Right. Okay. Thank you for calling. Miss Francis, you want to... She's not too keen on using medication.
Medication.
It's understood she's already
Yeah.
using medication for her high blood pressure.
Yeah.
So, she wants advice as what else she could do,
Okay, so not knowing a lot of what your diet actually is like, which would help. But what I can suggest is including or increasing the amount of what cereals you eat, like oats, bran flakes, those types of cereals, not the sugar and the sweet ones.
Right.
So those types of, because they are so high in fiber, they can actually assist in helping to lower the cholesterol.
Yes.
So you can include those as well. Of course, your greens as well will help you a lot. Sweet potato would be good to include in your diet. High fiber again, and it's what we call like a superfood. So that will help as well. And decrease bread, white or otherwise. You don't have to have that in your diet. It may be exacerbating the issue, making it worse. So you can leave that out. And in terms of like fat content, you have to reduce the amount of fat that you're having. So even if you're looking at things like fried stuff every now and then, or scrambled, just leave that out.
Yeah.
Bake, boil, stew, do something else.
Right.
Not stew, because stewing may include adding gravy browning, and you don't want that. So if you're gonna stew, just stew white. Make use a little turmeric for color, a little bit. You can have those things instead, and that would probably help. You can try those changes. Of course, you'd have to come in to see us to get a full, assessment.
Right.
That would help. But you can start. You can start with those.
Oh,
I hope that's
definitely.
helped.
Excellent. And exercise always helps.
Exercise
high blood
always
cholesterol.
helps.
Absolutely.
Exercise is always good because
Always
when
helps.
you exercise, you burn fat.
Absolutely.
And cholesterol is fat, right?
Although cholesterol is fat, is a component of fat, but it is a substance that stands alone, and also the body creates it. So that's why we need to find out exactly what's happening with it.
Beautifully said. Beautifully said. So we're going to wrap up with our last two tips. And our last two tips are not heavily medical, but they belong there. So our penultimate tip starts with you, and it's you for unwind. And I've chosen this tip and chosen this image because, we don't make great use of the beach here.
Oh, that is so true. We need to relax a bit more. Life is stressful.
Oh yeah, and we have the beaches.
We have the beaches right here,
We live on an island,
Paradise.
And
we're not using it.
The beaches can be used to walk, to jog,
or
to
unwind.
swim, to play ball, or unwind. Simply, just listen to the waves crash on the sand.
Absolutely.
I mean, the beaches are seriously therapeutic, man.
It really is.
And I definitely think we're underutilizing our beaches right now.
I totally agree.
Yeah, and we don't have to go there with lots of loud music and friends. Just have a nice quiet moment with nature, relax. Stress kills. A lot of the problems can be made worse by stress, high stress. Work is stressful, home is stressful, so many things. Let's unwind.
Let's unwind. And we can unwind in other ways. You can go dance. I'm actually very happy now that our older folk go dance country and western. It's St. Lucia, country and western is huge, huh? Is country and western huge in California?
Man. In parts, I guess. It depends on where you are.
All right.
Yeah, it depends on where you are. Different parts.
So the older folk dance their country and western. And I think that's all very good.
Absolutely.
Unwinding is good. All work and no play makes Jack a dull boy.
Yes.
And the dull boy issue is serious, because this is depression, eh?
Yes.
And depression is for real.
Yes.
So our very last tip is one of my favorite. I think applies to all of us. We live and we need to learn.
Absolutely.
Yes.
Yeah.
Definitely. We're never too old to learn. And of course, we want to, whenever we go through something and we learn from that experience, we want to keep what we've learned and apply it to our life. Because when you do apply it, then other people can learn from you.
Definitely.
So it is something that we should all apply to our lives, live and learn. That never gets old.
Live and learn. And living and learning is not just having the experience. It's not just gaining knowledge. It's actually applying it so that it causes a positive change in our behavior.
In our mindset.
In our mindset, in our behavior. There must be a positive change for us to have learned.
Absolutely.
So live and learn. So, Matt, let's see if we can do a little bit of English language and put the acronym together so we can end this program.
All right.
Right. So we started with Y.
Yep.
Our first tip.
Y.
Y for you.
And then the big O.
And the big O
Orange
for Orange.
County.
Orange County.
There we
Matt
go.
as our special guest.
That one.
And then we had U
for
urology.
Man's best friend.
Man's best friend. They can't forget. Guys, you can't go wrong with urology. And then we had A. So Y or U, we'll say is you, right? That's you. So far, that's you.
That's
right.
me.
So A.
Abstain.
For abstain.
Yes.
R for run.
Run.
As run for your life. right? E for eat less.
Right.
Live longer.
Live
so
longer.
so far you have Y-O-U-A-R-E.
R-E.
You are.
You are. All right. So B,
Bananas.
bananas beware.
Don't go bananas
Don't
with the
go-
bananas.
Don't go bananas over bananas. Thank you very much. And E, we said eggs are not for everyone. A, I think some people are figuring it out already.
Yeah,
A,
aspirin.
which was aspirin,
Aspirin.
a day, may keep the doctor away, right? U, use as prescribed. You guessing what the word is, Matt?
I'm getting
You
close.
get it?
And yeah,
So we had
for
tea
time.
for tea time. All right. I, we said iron is
Iron,
not for everyone.
Not for everyone.
F, fiber, which came up
Fiber.
a lot today. U, your favorite, Matt.
Now I'm
You
getting
can't
really-
forget that one. What's
now,
you?
Now I'm getting really close.
What's you, Matt?
You was
That's your favorite. You
That was
teach me
my
about this
favorite
all
one.
the time. You was unwind. Remember?
You gotta unwind.
You
man.
gotta unwind.
You gotta unwind.
And L, we said
Live,
live
and
and learn. So, viewers, our 15 tips as we put up our image here is something that we should not forget. Right? Y-O-U-A-R-E-B-E-A-U-T-I-F-U-L. You are beautiful. You need to always give yourself that much esteem and, you know, make sure you take care of yourself. So this ends our first program for this season. It was what we expected it would be, that it would be a really fun, really good program. It's been a pleasure having Soria as our nutritionist. I'm sure, you know, we can coax Soria to join us again. Matt, I know you leave us soon, so it was a pleasure having you as well.
Thanks for having me.
Would you want to say hello to your folks in California? Maybe they're watching via the internet.
Definitely a big hello to everyone, especially my little sister Summer, Amuni, my beautiful wife, my parents, and my father. I hope you guys, you know, took some tips from this, and you guys can actually go and, you know, get that prostate checked out.
Wonderful, wonderful.
Thank you.
Awesome. Thank you very much. This was beautiful, and both of you are beautiful. You too, Matt. You're beautiful.
It's all you.
Thank you very much for watching. This has been our first show for 2015, our new season. Pulse, live on Choice TV. Look out for our next show next week, Tuesday. Good night.